Good evening to everyone and welcome to today's discussion. 21st March today, we still have about 90 more days before we hit the jackpot. Now it looks like 90 days, but as we approach the exam, as we approach the deadline, it looks that the time is dwindling down, but actually we are reacting to the time. There are 50,000 high-yield facts that you need to master. I'm creating a new technique to analyze, visualize, after summarize, to memorize, to reproduce in the exam very quickly these 50,000 high-yield facts in the form of mind map PDFs. So these mind map ebooks on each subject, they're all available. I leave the link to you. Click today, the link below, learnograph.com. And there you get to buy each of these subject mind maps. So every day we will have a live class and a mock test and discussion. So be my guest, enjoy the revision, how it feels like when you are answering the real NEETPG exam through these mock tests and discussions. So let's make the great beginning, Doctor. Very nice to see 12 online classmates. Excellent. So can the online students can punch? Is the voice loud and clear for all of you, Doctor? So today is just a premiere. That's the reason I want to discuss around 50 questions. Down the line, we will have all the 200 questions fully discussed. So you give me a feedback, how you felt being part of this test and discussion every day until the next 19 days, the NEETPG exam happen. So can the online students can punch? Is the voice loud and clear for all of you, Doctor? Yes. Now, let's take up the first question. A nutritionist is educating about the heart health. So the patient is advised to increase the intake of certain types of fats, which are good for the cardiovascular health. Which fatty acids are cardioprotective and have anti-hyperlipidemic effect? So you know that the omega-3 fatty acids, which are called as the essential fatty acids, and linoleic acid is the one which is considered to have the cardioprotective and anti-hyperlipidemic effect, unlike the trans unsaturated fatty acids is what you need to remember. So quickly, doctor, what are essential fatty acids? They cannot be synthesized in the body, and they help in the production of the leukotrienes and prostaglandins. They are anti-hyperlipidemic, whereas the trans unsaturated fatty acids, they increase the LDL and decrease the HDL, promoting the cardiovascular disease. So this is all about our first question. Now let's go to the next question. A 54-year-old male with a history of hyperlipidemia is being advised to take a vitamin to help to manage his condition. This vitamin is also the part of the NAD plus and NADP plus, and it is used for the redox reactions in the body. Which vitamin are we talking about? We are talking about the niacin. What is niacin, doctor? Vitamin B3 is the niacin. So you know very well that B3 is also called nicotinic acid, part of redox reactions, cofactor of dehydrogenases, and tryptophan gives rise to the niacin. Also for vitamin B2 and B6 we require tryptophan. And to treat the dyslipidemias, niacin is used clinically, because if you give niacin, it will decrease the VLDL levels and increase the HDL levels is what you need to remember. So what are the 5 high-yield facts you want to remember about the niacin? Basically, it is derived from NAD is derived from niacin, and 1 NAD is equal to 3 ATPs is what you need to remember. It is used to treat the dyslipidemia by lowering the VLDL and raising the HDL. Niacin is derived from tryptophan and it is the part of the NAD plus and NADP plus. It is vitamin B3 is what you need to remember. Once more, Dr. Babu and many more who are all online. Nowadays, everything is mind maps. How you summarize, how do you present, how do you remember, how do you visualize, how do you recall, how do you do revision. I will give you these 50,000 high-yield facts into 5,000 mind maps. That is all that you need to cursorially do the revision for the tomorrow's NEETPG exam. So good, Babu, for active participation. I want you to actively involve in the mock test discussion, test and discussion. Daily, we'll try our best to conduct a mock test and a discussion. So now, doctor, let's go to the next question. So every MCQ is being presented like a mind map. A 45-year-old male, 45-year-old male presents with swollen gums, easy bruising, petechiae, reports a poor diet, which is part of his tea and toast. There are perifollicular hemorrhages, corkscrew hair. What else is required? It is classically the vitamin C deficiency. Vitamin C is very important for collagen hydroxylation. Without that, there is a weakening of the blood vessels, connective tissue, and the bone, which all will manifest with these symptoms. Now, quickly, doctor, 5 high-yield facts about vitamin C. Tea and toast lacks vitamin C. There are perifollicular and subperiosteal hemorrhages is what you need to remember. Poor wound healing. Corkscrew hair. These are all the buzzwords which you need to remember for the tomorrow's exam. Now, the next question, doc. A patient is admitted to the emergency department suspected of methanol poisoning. What is that? Methanol poisoning. What is the most appropriate treatment to inhibit the methanol metabolism? It is the fomepizole, not flumazenil. Fomepizole is what you need to remember when it comes to antidote of methanol poisoning. Now, quick facts. A lot of times this question is asked, is it alcohol dehydrogenase or aldehyde dehydrogenase? Which is the one which is associated with fomepizole? You remember, fomepizole, right? So O and alcohol, not aldehyde, alcohol dehydrogenase. There's a higher affinity for ethanol. Alcohol dehydrogenase has a higher affinity for ethanol than for methanol or ethylene glycol. So that is the reason you can use ethanol, can be used as a competitive inhibitor of methanol or ethylene glycol poisoning, but it is less preferred than fomepizole. Fomepizole is a competitive inhibitor of alcohol dehydrogenase, and it is the preferred antidote for the methanol and ethylene glycol poisoning is what you need to remember. So one is you can use fomepizole, other is ethanol. Both of them can be used to treat the methanol, poisoning is what you need to ultimately remember, doctor. Now, the next question comes. A biochem student is studying the regulatory mechanisms of glycolysis. Now, the question is asked by the examiner is, what is the primary regulatory point and is considered to be a rate limiting step of glycolysis? So you should remember that it is the fructose 6-phosphate to fructose 1,6-biphosphate by the phosphofructokinase is considered to be the rate limiting one. It is considered to be the main regulatory and rate limiting step of the glycolysis. And what regulates the PFK1? PFK1. ATP, it is inhibited by ATP. Whenever ATP is high, that means there is a high energy, there is no need of glycolysis. That's the reason. A high ATP means high energy, and high energy causes the inhibition of the rate limiting enzyme PFK1. Similarly, citrate and activation. So citrate also, like ATP, is an indicator of a high energy status. That's the reason both of them will cause the inhibition of PFK1. Whereas AMP means low energy. You will need more glycolysis. That's the reason AMP will stimulate the fructose 2,6-biphosphate is what you need to remember. So ultimately, what is the tomorrow's NEETPG exam favorite question, doctor? Fructose 1,6-biphosphate formation from fructose 6-phosphate is by the action of PFK. PFK is considered to be the regulatory enzyme is what you need to remember. So always, mind maps is a way by which you need to have 5 points, 5 funda about each of the concepts. So funda number 1, pyruvate kinase is regulated by fructose 1,6-biphosphate, ATP, alanine and glucagon. Remember, pyruvate kinase. Then what are the ATP producing steps in glycolysis? Phosphoglycerate kinase and pyruvate kinase. And how is hexokinase regulated? It is the glucose 6-phosphate which regulates, and PFK1 is by ATP, AMP, citrate and fructose 2,6-biphosphate. And what is the rate limiting step of conversion of fructose 6-phosphate to fructose 1,6-biphosphate? It is the PFK1. And what steps require ATP in glycolysis? Another very favorite MCQ. Hexokinase, glucokinase and phosphofructokinase 1 is what you need to remember. Very nice to see 15 online classmates. So doctor, mind maps and mind maps. For every medical student, the challenge is NEETPG aspirant. Within the short period of time, how am I going to become the king? How am I going to become Sher Khan? How can I be able to crack the NEETPG? The new mantra is the mind maps by Dr. Murali Bharadwaz. I have left a link below, learnograph.com. So once you go, you have the store. Quick revision of biochemistry, mind maps. Quick revision of ophthalmology, 1500 high yield facts and 150 mind maps. So every mind map is a very focused content, straight away entering the facts into your brain. No reading of long sentences, long notes. So today only click it and then pay and download the PDF and enjoy your preparation. And every day, don't forget to come to this live discussion of the mock test to charge your preparation by Dr. Murali Bharadwaz. So, doctor, the next question, let us take up the next question. A 4-year-old child, let's go to the next mind map. Yes. A 4-year-old child is brought to the pediatrician. Sweet smelling urine, The child is otherwise healthy, no growth or developmental delays. Urine test confirms fructose. Then what is the most likely condition? It is essential fructosuria. बहुत कुछ मसाला है इस टॉपिक के ऊपर. Lot of people have a confusion. What is meant by essential fructosuria and hereditary fructose intolerance? It is a defect of fructokinase, which is called essential fructosuria. It is autosomal recessive. एक एंजाइम एब्सेंट होता है, वो है fructokinase, and that is the reason the fructose is being trapped inside the cells. Now, since fructokinase is not there, the stepmother will come, hexokinase. It will say, I not only know how to convert glucose to glucose 6-phosphate, I also know how to convert fructose to fructose 6-phosphate, and it converts the fructose to fructose 6-phosphate, but at a slower rate. Kabhi bhi stepmother will not feed you as fast as the own mother, right? So own mother is fructose 6-phosphate. Its deficiency is basically essential fructosuria. So then the glucose 6-phosphate will take over. And because of that slow metabolism of fructose to fructose 6-phosphate, the fructose get accumulated in blood and urine is what you need to remember. But ultimately in essential fructosuria, fructose का metabolism होता या नहीं होता? होता, मगर slowly होगा. इसके वजह से essential fructosuria is relatively harmless. Harmless is what you need to remember. Now, doctor, let us quickly see 5 high-yield facts from this mind map on fructosuria. It is less severe than the disorders of the galactose metabolism. The fructose in the urine will appear and make the urine become sweet smelling. Essential fructosuria is benign, asymptomatic, does not trap the fructose in cells. It is autosomal recessive. It is the fructokinase defect is what you need to remember. Once more, doctor, biochemistry. Don't forget biochemistry snapshots. Snapshots. Today only go and download this mind maps, the biochemistry snapshots mind maps. 150 mind maps में मैंने 1500 high yield facts का रिविजन किया और learnograph.com के ऊपर रख दिया. आप खाली जाके PDF डाउनलोड करके रिविजन करना. आज ही शुरू करो मेरे प्यारे देशवासियों. So now let's go to the next question. A 30-year-old with sore throat, fever, anter-cervical lymphadenopathy. Let me get the pen. Yeah. So let's go to the next question. A 30-year-old with sore throat, anter-cervical lymphadenopathy, a rapid antigen detection test is positive for Streptococcus pyogenes. Which antibiotic is best? Always penicillin G. क्या है जी? Penicillin G is the treatment of choice for Streptococcus pyogenes, which is a gram-positive organism. And how does penicillin G work? It works on acting on D, Allah, and it binds with penicillin binding protein. It blocks the cross-linking of the peptidoglycan, and that is the reason it has got a bactericidal activity on the gram-positive cocci and some of the gram-negative cocci, but east or west for the spirochetes, penicillin, even today, it is the best. Syphilis के लिए क्या best है डॉक्टर? Penicillin. And it is both IV, IM and oral form. Oral form of penicillin is called penicillin V. Remember, penicillin V is the oral form. V for vagina, V for oral form. So easy to remember. So now, doctor, let's talk about 5 important high-yield facts about penicillin. So it is the beta-lactamase which is responsible, mutation in the penicillin binding proteins is responsible for the resistance. What are the main side effects of penicillin? Hypersensitivity, hemolytic anemia, interstitial nephritis. Please don't forget. Interstitial nephritis and penicillin. Please don't forget. Penicillin is bactericidal. And where is it indicated? Gram-positive, Streptococcus pneumoniae, some gram-negative cocci, and spirochetes, especially treponema, palladium. And how does it act? It binds to the PBGs and blocks the peptidoglycan cross-linking. And penicillin is a prototype of all the beta-lactam antibiotics. Now, doctor, let's go to the next question. 60-year-old male with sepsis found to have gram-negative rod bacteremia, currently receiving beta-lactam. If you want to give a synergistic effect to this beta-lactam antibiotic, what is the most important drug you want to add? So you should remember aminoglycosides. So what are the aminoglycosides, doctor? Gentamicin, neomycin, amikacin, tobramycin, streptomycin. And what is that subunit? 30. You remember A for aminoglycosides, T for 30. It inhibits protein synthesis. Aminoglycosides are particularly effective where it is a gram-negative rod infections and they have got a very good synergistic effect with beta-lactams. And they cause, how do they act? One of the favorite question, aminoglycoside mechanism of action. It is the initiation complex. A is the first letter. Initiation ka matlab first. To initiate means first. Remember, aminoglycosides inhibit first, that is initiation complex. They lead to misreading of MRI. They block the translocation. But very important thing about aminoglycosides, they need oxygen for the uptake, and that's the reason they are useless against the anaerobes is what you need to basically remember. So, fatafat bolo doctor, 5 important high-yield facts about the aminoglycosides. So how does aminoglycoside resistance occur? Acetylation, phosphorylation, adenylation lead to the aminoglycoside resistance. What are the side effects? Nephrotoxicity, neuromuscular blockade. This is one of the favorite anesthesia MCQ. Which antibiotic can prolong the neuromuscular blockade? Aminoglycosides. Ototoxicity, teratogenicity. Where is it especially important? Aminoglycosides. Gram-negative infections. And they have synergistic effect with beta-lactams. They cause irreversible binding with the 30S ribosomal subunit. Gentamicin, neomycin, amikacin, tobramycin, streptomycin. That is what you need to remember. The next MCQ on the mind maps with Dr. Murali Bharadwaz. Can you please punch, doctor? Is the voice loud and clear for all of you? नीचे आपको दिख रहा है learnograph.com को जाना, वहां पूरा mind map revision 1500 high yield facts in 150 mind maps on every subject. Hardly takes 7-8 hours for you to do the revision. जाना, Paytm करना, 400 रुपए on each PDF, download करना और आपके iPad के ऊपर आराम से mind maps को revision करना. Simple, right, doctor? And every day I conduct the mock test and discussion where you get opportunity to do the revision. Right, doctor? That is very important. जितना mock test आप ले सकता उतना mock test लेना पड़ेगा if you want to dream to become the topper in the tomorrow's NEETPG exam. Coaching आप कहीं भी ले लो, videos आप कहीं भी सुनो. What do you need? You need Dr. Murali Bharadwaz, the mind maps for you to do the revision and become the topper in the tomorrow's exam. So, doctor, let's make the discussion. The next question. Can the online students can punch? Is the voice loud and clear for all of you? Please. Now, a 55-year-old man, 55-year-old man, 1 minute. 55-year-old man, IV drug abuser, presents with fever, murmur, IE, infective enteritis, MRSA positive. Oh my God, that is very dangerous, very scary. Which antibiotic is best for the infection, doctor, and what is the mechanism? Daptomycin. So what is daptomycin? Fatafat bolo. Lipopeptide antibiotic. It disrupts the cell membrane of the gram-positive cocci by creating transmembrane channels. So bacteria के membrane में holes बनाएगा. It will cause the disruption of the cell membrane, lead to cell death. And where is it indicated? Daptomycin, daptomycin, daptomycin. MRSA, infective enteritis, vancomycin resistant enterococci. And very important about daptomycin, don't use for pneumonia because pulmonary surfactant will cause the inactivation. Pulmonary surfactant lead to inactivation of daptomycin. And give it to MRSA, infective endocarditis, because it is the best choice because of its efficacy against the MRSA and the specific action on the cell membrane of the gram-positive organisms. Now, quickly, 5 important high-yield facts in this mind map based MCQ on daptomycin. You call daptomyo skin, daptomycin, skin infections. It is used, but it can lead to myopathy. It can lead to rhabdomyolysis. Don't use for pneumonia. It is used for MRSA, bacteremia, and infective endocarditis. And it is a lipopeptide antibiotic is what you need to remember. So that is short and silly, the mind map about daptomycin, doctor. Now, a 25-year-old female, painful white coating on her tongue, difficulty swallowing, and she has a history of recent antibiotic use for the UTI. What is the best medication? Nystatin is what you need to remember. Nystatin. So what does that white membrane also suggest? Oral candidiasis. Whenever you use antibiotic for a long period of time, it leads to oral candidiasis. Because all your antibiotics will disrupt the normal microbiota. Nystatin is especially swish and swallow regime of oral candidiasis. It is effective on Candida species, but you can't use it systemically. That's the reason mostly used topically, like oral thrush, diaper rash, vaginal candidiasis. We use nystatin. Quickly, batao 4 important high-yield facts about nystatin, doctor, for the tomorrow's NEETPG. So every mind map, you get around 10 high-yield facts covered. एंड 150 माइंड मैप्स में आपको 1500 हाई यील्ड फैक्ट्स मिल जाएगा. टुडे ओनली गो टू lernograph.com. There you have all the books available. Just click it, PDF डाउनलोड करो. बस आपके लैपटॉप और आईपैड के ऊपर पूरा माइंड मैप्स आके लोड हो जाएगा और आपका प्रिपरेशन गर्मा गर्म आगे बढ़ेगा. नाइस टू सी कीर्ति, जिष्णु, थैंक यू फॉर द फीडबैक. So Dr. Pauline class of, which class does it belong to? It belongs to Pauline class of antifungals. It binds to ergosterol in fungal cell membrane. It is used topically for diaper rash and vaginal candidiasis, swish and shallow regime, and also it is used only topically, is what you need to remember. Now let's go to the next important mind map. A 40-year-old with renal transplantation, CMV infection is being found. Which medication is appropriate to treat? You want to give ganciclovir. So ganciclovir का कहानी क्या है? Ganciclovir is a guanosine analog. It is specifically activated by a CMV viral kinase. Before ganciclovir become active, it need to be converted into ganciclovir phosphate. And who will, so all phosphorylation is by what? Kinases. Who provide that kinase? Virus itself provide kinase. देखो virus का kinase लेके ganciclovir को phosphate बना के फिर virus को they are killing. And it preferentially inhibits only the viral DNA polymerase. That's the reason human DNA polymerase is not affected. Good. And it is primarily used for CMV infection, especially in immunocompromised patients and those who have undergone organ transplantation. So ganciclovir का बड़ा भाई होता है valganciclovir. Valganciclovir. It offers better oral availability, but it can lead to myelosuppression, renal toxicity. And how does the resistance to ganciclovir occur? Ganciclovir can only become active by the action of the kinase provided by the virus. So if that viral kinase recognizes, oh my God, if I make ganciclovir become ganciclovir phosphate, this ganciclovir phosphate is going to kill me, so I don't change the ganciclovir into ganciclovir phosphate at all. बोल के अगर उसके मन में सोच आ गया तो that lead to resistance to ganciclovir. So whereas foscarnet, what is that drug, doctor? Foscarnet is that antiviral which don't need such phosphorylation. There is no dependence on the viral kinase. That's the reason wherever ganciclovir or acyclovir resistance is there, हम किसका इस्तेमाल करना? Foscarnet का इस्तेमाल करना. Now, doctor, what are the side effects of the ganciclovir? Quickly, always before we go to the next question, we should summarize. Myelosuppression, renal toxicity. And where do we use ganciclovir? CMV infections in immunocompromised. And it is activated by the viral kinase. These are the points you need to remember. Now let's go to the question number 12. So good to see 11 online classmates. From tomorrow I should see 100 online classmates. Right, doctor? Now, 52-year-old who has got chronic hepatitis C with genotype genotype 1A is being evaluated for the treatment options. Which class of the drug directly targets the HCV's RNA-dependent RNA polymerase and offers a very high barrier to resistance. It is NS5B inhibitor. What are NS5B inhibitors? Among the antivirals, फटाफट बोलो डॉक्टर, ditto question, कल के NEETPG में आएगा. So now, NS5B inhibitors are sofosbuvir, dasabuvir. They target the hepatitis C virus NS5B protein. भैया NS5B protein कहाँ चाहिए आपको? It is a RNA dependent RNA polymerase which is needed for the viral RNA replication. If that is being inhibited by these NS5B inhibitors, that will prevent the new viral genomes. It stops the replication cycle of the virus. And that's the reason these have a very high barrier of resistance. That's the reason they are the cornerstone. What are cornerstone? NS5B inhibitors are the cornerstone of the therapy of HCV infections. You'll remember me in exam hall when they asked the same question. Now let us take 5 important Garmagaram points in this mind map about the treatment of hepatitis C infection. Ribavirin is used in combination with other drugs, but it does not directly target NS5A or 5B. All NS5A inhibitors cause headache and diarrhea. NS5B cause fatigue and headache. NS3-4A inhibitor. There is another thing called NS3-4A inhibitor. Grazopravir, Simipravir. They inhibit protease, which is involved in viral polyprotein processing. Whereas NS5B inhibitors, what are they? Sofosbuvir, dasabuvir. They target what? RNA-dependent RNA polymerase, and they give a very high barrier to resistance. Then what is NS5A inhibitor? Ledipasvir, umbitasvir, velpatasvir. They all affect the viral RNA replication. So that is all the story about hepatitis C virus, doctor. Now the question number 13. Mind maps is the secret by which your revision, solving questions, discussion, everything become very easy. 23-year-old with high fever, rash, hypertension, using tampons during her menstrual period. The blood cultures are pending. Everything suggests toxic shock syndrome. Which bacterial toxin can lead to this? This is called Staphylococcus toxic shock syndrome, caused by TSST1 is what you need to remember. So fundamentally it is called super antigen TSST1. And because of that, there is a massive immune response is what you need to remember. And Streptococcus pyogenes produce erythrogenic exotoxin A. Very important to remember. It can lead to scarlet fever and lead to shock. And why super antigens are super? Very important. Super antigens directly bind with MHC class 2. They bind with T cell receptors. They bypass the normal antigen presentation process, and that all lead to the development of the toxic shock syndrome. So proper menstrual hygiene, cautious use of tampons, that is all needed to prevent the TSS is what you need to remember. Now, doctor, the next question comes here. 1 minute, let me take a little water. Very good. Good to see. Nice to see Santosh, Ashish Jain, Kirti, and many more who are all online. So we are all now preparing with the help of mind maps. 1 minute, doctor. I'll just pick up some water and come. Now, coming back to the session, yeah, is the broadcast cool? Are you able to see? Are you able to review comfortably? Can you please punch, doctor? I wish the broadcast is fine, right? Can you please punch? Which describes the function of periplasmic space in gram-negative bacteria. It is the site for accumulation of hydrolytic enzymes, including beta-lactamases. So where is the periplasmic space, doctor? It is between the inner cytoplasmic membrane and the outer membrane, between the two, the peptidoglycan layer. And this periplasmic space is very important because it accumulates the various components which are exiting the cell, like beta-lactamases. And these beta-lactamases are very important to decide the antibiotic resistance and protect the bacteria from their antibacterial effects. That's what you need to know about the beta-lactamases and periplasmic space. So the processing of the nutrients, defense mechanism, various cellular process, they're all the functions of periplasm. Periplasmic space also has beta-lactamases. It contains peptidoglycan. If you look at peptidoglycan, it is thicker in the gram-positive. In the gram-negative, the peptidoglycan is thicker in the gram-negative compared to the gram-positive bacteria, is what you need to remember. Now, a 45-year-old with a history of splenectomy after a motor vehicle accident is seen for routine checkup. Which vaccination you want to give? Neisseria, pneumonia, Haemophilus type B, all of them. What is common to all of them? They're all capsulated organisms, doctor. They're all capsulated organisms. You need to give the vaccination against all the capsulated organisms, because spleen has a very important function. It has got a opsonizing ability. That's the reason asplenic individuals have a great risk of encapsulated organism infections, is what you need to remember. A patient has fever, hypotension, history of consuming undercooked ground beef, high level of endotoxin. So this condition is caused by exposure to which type of bacterial toxin? Of all, it is the endotoxin. Endotoxin, specifically the lipid A component of the lipopolysaccharides, are found on the outer cell of the gram-negative bacteria. And they lead to all that fever, shock, hypotension, DIC, which occur whenever there is a endotoxic shock in gram-negative sepsis. So what are those exotoxins secreted? Tetanus, botulinum, diphtheria, cholera, they form exotoxins. That's the reason you can create toxoids and vaccines against the tetanus, botulinum, diphtheria, and cholera. And the toxins are part of outer membrane of gram-negative bacteria. That's the reason we can't form any vaccine or toxoid against a gram-negative bacteria. That is very, very, very important. Now, doctor, the next question. The laboratory technician suspected a bacterial infection. The culture shows gram-positive rods, medusa head appearance, test positive for polypeptide capsule. What else is needed? It is Bacillus anthracis. So it is a polydeglutamate polypeptide. What is that called? Medusa head appearance. Medusa head appearance. And it has a protective antigen, lethal factor, edema factor. So many things are associated. And what type is Bacillus anthracis, doctor? Gram-positive spore-forming rod is what you need to remember. Now, the next question. We have a vaccine against the H influenza type B. But after the vaccine was introduced, presently what is the common cause of otitis media, conjunctivitis, bronchitis? It is the non-typable encapsulated strains which are the most common cause after the wide prevalence of using the vaccines is what you need to remember. Now, what describes a cellular adaptation, physiological cellular adaptation? Uterine enlargement during pregnancy is called the physiological cellular adaptation in general pathology. The patient has left lower quadrant, long-standing, poorly controlled hypertension. Specific region of the colon, there is a reduced blood flow because of atherosclerosis. What type of ischemic injury it is called? Watershed areas ischemia. So, जहाँ गंगा नदी और जमुना दोनों मिलके मर्ज हो रहा है उसको watershed zone they call it as. So what are the common causes of ischemia? Atherosclerosis, Buchieri, testicular torsion, all of them can lead to sudden shock. And most susceptible to the hypoxic ischemic damage, what are they? Purkinje cells of cerebellum, pyramidal cells of hippocampus and neocortex. They're all susceptible to hypoxic ischemic damage is what you should remember. Now, a 55-year-old man, progressive heart failure, neuropathy, transthyretin gene is mutated. What type of amyloidosis is this? Hereditary transthyretin amyloidosis. So anything you need to know, doctor? I leave the literature for you. So, typically, the hereditary transthyretin amyloidosis presents with restrictive cardiomyopathy, arrhythmias, polyneuropathies. They're all the presenting features. Now, a 24-year-old redness, swelling, pain in her left foot following a sprained ankle. So what is that called? That's called acute inflammation. Easy question. Now, during the process of wound healing, all that vascular remodeling, smooth muscle cell migration, stimulating fibroblast growth and collagen synthesis, that is all typically the platelet-derived growth factor is the one which controls. So you should know fibroblast growth factor, transforming growth factor, platelet-derived growth factor. What are their functions? Epidermal growth factor, you should know. Epidermal growth factor stimulates cell growth by acting on tyrosine kinase stimulation, is what you should remember. Now, cancer cell spreading is called metastasis. Sometimes some easy questions to make you feel happy. You are assessing human poverty index. Which component is considered a critical measure of societal well-being and economic stability, doctor? Percentage of the people living below the poverty line is a very, very important indicator. Now, what are the primary purpose of public health surveillance? You want to collect and analyze the data so that you get some actionable items to prevent and control the disease is the main purpose behind public health surveillance. What do you mean by disease elimination? Reducing the incidence of the disease to zero in a specific area is called as the elimination. So, what are the conditions that India has successfully eliminated, Dr. Guinea worm in Feb 2000, leprosy in December 2005, yaws in September 2006. They are the diseases which are eliminated. Whereas eradication means you permanently take it away from the planet Earth. Is called eradication. Now, doctor. So, you used a bed net to prevent mosquito bites like malaria and which are prevalent. What type of prevention you call? Primary prevention and specific protection. So, you should know what are the different levels of protection. Specific means it is very specific to kill the mosquito bites, or you have given vitamin A to the community, you have given vaccinations. It's all specific protection. Specific protection. Primary prevention means to prevent the occurrence of the disease, focusing on the risk of decreasing the risk factors is called primary. Whereas early diagnosis and treatment is called secondary prevention. Now, primary level of prevention through specific protection, what is an example? Reducing the occurrence of the polio by immunization is an example of the primary level of prevention through specific protection. Which healthcare delivery is crucial to assess the accessibility and potential quality of medical services? It is the doctor population ratio, which is very, very important. Now, you're adjusting the rates of comparative epidemiological studies. What is the role of a standard population in a comparative epidemiological study? Basically, the choice of standard population is arbitrary, and it can be an existing standard or a combination of multiple populations you can take as a choice of standard population is what you need to remember. So, what defines a pandemic? It is an outbreak of a disease that occurs over a wide geographic area and affects a exceptionally high population. Global spread. So 1918's influenza pandemic, H1N1 pandemic of 2009, etc., etc. Which epidemiological design is best? You want to establish incidence rate of disease and calculate relative risk. It is the cohort study which is the best if you want to know the incidence rate and calculate the relative risk. Relative risk, doctor. So you have all these mind maps, very easy. Quickly you will get 4 or 5 points about each of these MCQ. So today only go to the learnograph.com and there you are having all the mind maps available. Download the PDF and then happily prepare for the exam. Which is the best way to control the confounding in randomized control trial? It is the randomization is the most ideal method for controlling the confounding in the design phase of the study, is what you need to remember. So we use the matching in case control studies to ensure that each case has corresponding control. Then restriction involves limiting the study population to individuals who share the same characters. That is called restriction. Stratification means make it into subgroups that share the common characters. Statistical modeling means multivariable regression analysis that allow the adjustment of the confounding variables. When multiple confounders are there, we do statistical modeling. Now, what is the primary purpose of randomization in randomized control trial? You want to ensure the study groups are comparable at the baseline. For both the known and unknown co-founders, we do the randomization. That is the primary purpose. Primary purpose, doctor. So why is the incubation period of the disease is important in the epidemiology? Because it is crucial for tracing the source of infection and contacts. You need to know the incubation period, which is the time between the exposure to a pathogen and the appearance of the first symptom is called as the incubation period. Now, what is the rationale behind using the twice the incubation period of the disease since the occurrence of the last case to declare an area as free from epidemic? So 2 times the incubation period cover the maximum time in which new cases could emerge, indicating the ongoing transmission. Now, doctor, which vaccine is contraindicated under the age of 1 year? The yellow fever vaccine in infants under 1 year because of the risk of adverse reactions. There are many more other supporting high yield points that you need to know for the tomorrow's exam. Now, which is correct about BCG vaccine? It's a live attenuated vaccine. And how do you do BCG vaccine? You give it intradermally, not subcutaneously. So 4 or 5 points about the BCG you need to know. The standard dosing kitna hai? 0.1 ml. Within 1 hour after you reconstitute the vaccine, you need to use it. Lyophilized form is more stable, and you give it intradermal, which is unique. No other vaccine is given intradermally. Now, DPT vaccine, 0.5 ml is given intramuscularly along the anterolateral aspect of the thigh. That is how you give the DPT. And there are some more high yield facts and a detailed explanation. You get it all in this PDF of the high yield facts. For every mock test, I give you the PDF. And today only go to learnograph.com and download the PDF, doctor. Very good to see 15 online class tests. Wow, abhi maza aa rahe hain. So, doctor, solve and solve. Discuss and discuss as many questions as you can before the tomorrow's NEETPG. I'm always there for you to hold your hand and take you forward for you to become the topper in the tomorrow's NEETPG. So, lot of information, very difficult to consolidate it. That's the reason I created what are called mind maps. 150 mind maps में मैं आपको 1500 points दे दूंगा. Today only go to learnograph.com. You have already biochemistry, microbiology, ophthalmology. 3 mind map book upload कर दिया. क्लिक करो, 400 रुपीज पे करो और माइंड मैप बुक को डाउनलोड करो. आपके पीडीएफ में सारे चीज आर अवेलेबल एंड यू बिकम द टॉपर. Every day we release one full scale mock test of 200 questions where explanations, high yield facts are all created in the format of mind maps and uploaded into the learnograph.com. So today only you bookmark and we keep sending you the updates every time the new mind map comes up. So solve as many mock tests as possible in the next 90 days. Let us make the best use of each other. Now, the next question. Which anatomical feature is considered most reliable for knowing the sex in forensic anthropology? It is the sciatic notch index. Did you guess? Sciatic notch index. So, sciatic notch index, what does it measure? It measures the angle, curvature of the sciatic notch. It is very important criteria in the pelvis for the sex determination. A wider notch is typically seen in female. Narrow sciatic notch is found in male pelvis, and this is the most preferred because it undergoes distinct changes related to the childbirth in females. That's the reason it is bigger. So that's what you need to remember. For the age determination in forensic cases, which anatomical site is most appropriate for assessing the bone age in children? It is the wrist and the hand. It is the X-ray of the wrist and the hand which will help you. So the upper end of the radius, ulna, which is the determining factor in adolescence that reflect the late stages of the growth. Now, doctor, what is the characteristic feature that differentiates an entry wound from an exit wound? Entry wound has a beveled larger hole in the inner table, while the exit wound has this feature on the outer table, which is the differentiator. Once more, in this mind map, I leave you everything about what is meant by collar burn, and exit wounds show external beveling because of the outward displacement of the bone. Entry wounds show internal beveling due to the inward displacement of the bone is what you need to remember. Now, a 32-year-old woman presents with headache, transient visual obscuration. Bilateral swelling of the optic nerve head is observed. What is the underlying condition responsible? It is a malignant hypertension. So papilledema, what is the meaning of it? It is a passive swelling of the optic nerve. Due to raised ICT, it can be seen in malignant hypertension is what you need to remember. So there's an impaired axon plasmic flow, venous stasis in papilledema. Intracranial tumors, benign and malignant hypertension, anything can be. To move the right eye outwards, narrowing of the eyelid opening while attempting to look inward. No family history of similar condition. What is your diagnosis, doctor? Duane's retraction syndrome. So, Duane's retraction syndrome is a congenital condition. Limited horizontal eye movement, especially abduction, and the retraction of the eyeball and palpebral fissure, narrowing upon adduction. Whenever they try to edit the eye, there is a narrowing. They are all the hallmark signs of Duane's retraction syndrome. Now you should know, why not Brown's? In Brown's, there is a difficulty with the elevation of the eye, especially in adduction. Mobius syndrome. Facial paralysis is limited to the also facial paralysis. Double elevator palsy, inability to elevate the eye in the primary gaze itself. So that's how you ruled out the other options. So एक mind map में आपको सब कुछ मिल जाएगा. All right, doctor. Now let's go to the next question. An ophthalmologist examines a patient with difficulty in looking downwards after trauma. Which extraocular muscle is affected? It is a superior oblique. The superior oblique main function is what? Intorsion, primarily. Secondarily, it leads to depression. Affects muscle or nerve supply can lead to a difficulty in depressing the eyeball, as you can see in this patient. So you should know what are the primary actions. This is one of the favorite lists you need for the NEETPG. Internal oblique extorsion, elevation, optometer. Superior rectus, elevation, intorsion, and adduction. Lateral rectus, abduction. Adduction. Inferior rectus is depression, extortion. Some other way you need to remember all these actions of the external 65-year-old with a gradual painless loss of central vision. Patient reports difficulty in reading the painless, gradual loss of vision over several years. This is the story of aged So sorry for internet break. So a 30-year-old woman is my voice loud and clear for all of you? Please punch, doctor. Now we are left with last two questions, doctor. 30-year-old woman presents with acute vision loss in her left eye, pain on eye movement, relative afferent pupillary defect, no history of trauma. What is the diagnosis? Retrobulbar neuritis. So fundamentally what she is having is multiple sclerosis that lead to retrobulbar neuritis. It's called relative afferent pupillary defect. So you should know what happens in multiple sclerosis, what all can happen in multiple sclerosis. There can be intermediate uveitis, impaired eye muscle function, nystagmus, internuclear ophthalmoplegia, internuclear, and retrobulbar neuritis. Anything can happen. The last question for the today's evening, doctor. 7-year-old brought to the clinic, poor performance in the school, difficulty reading the blackboard from a distance, but can read the books without any issue. It is noted that when letters are presented one by one, the child identifies them correctly but struggles whenever you group the letters. It is classical of amblyopia. Amblyopia. So he can identify the letters when presented individually but not in group, such as crowding phenomena. What is this called? Crowding phenomena, which is very typical and hallmark of amblyopia. In this, there is a reduced vision corrected by glasses alone, and often the children, you can identify them during the early part of the screening. So we do what is called neutral density filter test. So is the one which is used. We see crowding phenomena. There is also a reduced vision. So these are the things you need to know about the amblyopia. So with that, we come to the end of the today's wonderful evening, doctor. Every day milenge, rose padenge. Don't forget learnograph.com. Make it a point today itself to download the PDFs from the learnograph.com. 1 minute. So once you come to the learnograph.com, here you have these three PDFs for you to download, doctor. Ophthalmology, microbiology, biochemistry. So if you go to ophthalmology, here you have the buy now option. Then once you say buy now, you have to enter, and then you order, and then you can download. So take every opportunity to visit the learnograph.com, and you have all that you need. Currently, we uploaded 3 books: ophthalmology snapshots, microbiology snapshots, biochemistry snapshots. Each of them are having around 150 mind maps for you to do the revision. Thank you.